Hi friends, this is Dr. Ashwin. I'm going to talk now on the basics of instrumentation in endodontics. Instrumentation itself is a technically simple procedure to understand, but there are certain ways of understanding it, and every one of us are using maybe similar instruments or maybe different instruments, but they are having their own way of doing the instrumentation. They are very much comfortable with the different kind of instruments. Whether it is right or wrong, we may not be able to know, may not be able to judge. So we are going to see the nuances of the instrumentation techniques, the material with which the instruments are made, and the tools with which we can use them. Also, we are going to talk about the certain concepts behind this instrumentation. Okay, let me share the screen with you. Yeah, so here we go. So basically, there are two types of instrumentation. If you consider the canal as a funnel or cone, instrumentation number one will start from bottom to top. That means you will prepare the apical one third first and you go progressively up towards the coronal part. In second type of instrumentation, you first prepare the coronal part and then progressively you go down. Okay. The first type of instrumentation is called as step back. Second type is called as crown down. Now, as with whatever age advanced and we have got a lot of innovation in the dentistry, we got rotary instrumentation as well. So in rotary instrumentation, we generally follow the technique of crown down. So the preparation techniques are so many. You will find that there are so many names of similar techniques, or many times we give the name to the techniques. So clinician who doesn't know how to use the hand file is handicapped in the art of endodontics. Why so? Because whatever techniques, whatever instruments you use, those all instruments are of no use unless and until you know how to use the hand files, which are very, very basic, like hand file number K10, K15, how to use the K file, how to use the H file. All are very, very important because I have seen that basic mistakes what are done by the clinicians are they use the hand files, all the hand files in the same way, and that's not the way of doing it. Okay, so let us see what are the advantage of hand files. It will give you better tactile sensation. What do you mean by tactile sensation? It means the feel of the canal. Entering the canal means you are actually entering the other person's house where you do not know what is kept where. And if so, at night you will stumble down. And for that, you have to take the feel with your hand. Where is the where is the switchboard? So that way, that feel is called as a tactile sensation. Similar way, you are entering a completely blind canal with a blind view. You are completely entering the canal which is not known to you. So that's why you require to take the feel of canal, and this feel is given or better feedback is given by the hand file. Second important advantage is it to determine the direction and the curvature of the canal. Like 10 number K file is so tiny and flexible. Once it goes inside a curved canal, when you pull it out, it will take the shape of the canal. And that is what is very important. You will get to know in the initial stage of the preparation itself that you have certain kind of a curvature. So you can be cautious and you can choose your file system accordingly. So there are two main types of files, H files and K files. So H file is a very basic file. It is used in a bigger canal to prepare the canal where your rotary file seems to be short in terms of width. So if you have a big canal like this, for example, center incisor, if it has a big canal like this, your file may just be going like this. So it's not even touching the walls. So how will you prepare these walls? So these walls are prepared by the R dearest H file by circumferential movement. And how will be the movement of the H file? You just have to put it inside and they scrape the balls around while coming out. So action is while coming out, not while going in. So you have to actually scrape the walls all around. So when you scrape the wall all around, that's called as a circumferential filing. What about the K file? K file movement will be like this, watch winding. Okay, but with a little apical pressure. So 1/4 movement with the apical pressure and out. 1/4 movement with the apical pressure and out. What will happen? With the movement inside, it will engage the dentine, and the moment you try to pull it out, it will cut the dentine. So actually it is used in the negotiation of the canal, which is very, very important. So this is a very important file in the negotiation or finding the um, making the glide path, making a path for the rotary instruments to glide forward. Okay, what is this? This is the ice cream cone. Where is the ice cream more? Is it in the top or bottom? Of course, on the top. So if I ask you, where will you eat? Where will you start eating this ice cream from? Every one of us will say that we will start eating it from the big chunk of the ice cream. That means from the top. Why so? Because biggest chunk of the ice cream is there on the top. Yummiest part is there on the top. Our canal is like this. It is also conical shape. So now see, coronal part is little wider, apical part is slender. So where will the pulp more? Pulp will be more at the top. That means coronal part. Pulp stones will be more at the top, at the coronal part. Fibrosis will be more at the top, at the coronal part. Calcification will be more at the top, at the coronal part. Why I'm telling you all these things in a funny way? Because when you try to enter the canal, you will find all these hindrances blocking your file. So when you start your preparation, you have to remove those interferences in the first go. That means you have to prepare the coronal part first. That means you have to eat that chunk of ice cream first. The moment this is out, your lot of interferences are out. Your maximum of pulp is out. So your file will find less resistance to go in. And that is what we require. So this is called as ice cream cone theory according to me. So you have to remember this ice cream always. So whenever you are entering the canal with the rotary instrumentation, or crown down technique you are following, you have to remove the coronal interferences first. So you have to prepare the coronal one third first. So take the biggest bite first. So what is the concept? You will prepare the coronal part first, then you will enter the middle part and prepare it properly, and then going to the apical one third. So what you get will be the bigger canal which you prepare. So you have actually increased the funnel shape from the top, from the top. But what about the apical portion? Apical portion, our intention is to keep the apical portion as small as possible or as it is present naturally. So if you see this picture, the blue lines are the original shape of the canal and yellow line is the prepared shape of the canal. But see the end point of it. Both are having the similar diameter. That's why even if you prepare the apical third with only 20 number file, but the taper is more, that means funnel is more, that means you have prepared well. Understand? So this is the concept behind crown down technique. So, what are the advantage of crown down technique when you are entering in from the top? There are definite advantage of this treatment. First thing is there is a early debridement of the coronal part of the canal. So, when there is a removal of all the interferences or you are debriding the coronal part and pulp chamber from the pulp, your file find less resistance. It is easier to glide through. Then it enables the better penetration of irrigants. As you increase the shape of the canal from the top, your needle will slide in very easily and deeper. When you can deposit the solution deeper, you can have the action of solution deeper inside the canal. And that is how the deep cleaning can happen. It removes the interferences, as I said, it reduces the canal curvature, and it gives you the better feel of the canal. That means tactile sensation. So these are the advantage of crown down technique. So what are the materials we are using? We are using materials, we are using two types of instruments in the endodontics, at least two types. First is silver, first is stainless steel, and second is night eye. Now there are modification of night eye also. There are modification of stainless steel also. But basic instrumentation, metallurgy, only two: stainless steel and night eye. So what is night eye? Night eye is a exotic material. It has two important properties. First is shape memory. So whatever shape it goes inside the canal and take, the moment you pull it out, it will again straighten up and take its own shape. That's called as a shape memory. That means you are putting the file in the curved canal, it will go there making itself curved, but the moment you remove it out, it will again take its shape. That means it's straighten up. Even if you keep the file rotating at the same point, it will try to straighten up like this, okay, inside the canal also. Second important advantage is its super elasticity. So even if you have the curved canal like S-shaped canal, lot of curvature, the angle of radius of curvature is more, this file system finds it easy to go there because of its super elasticity. Now, what is the advantage and disadvantage of shape memory? Advantage of shape memory is it regains its form immediately. Disadvantage is when you are rotating the file in the curved canal and like this, if you are rotating it in the curved canal, it try to regain its shape and making itself straight. So what will happen? You have the round apical foramen, but the moment you keep your file rotating there, it will try to get straightened up. When it will try to get straightened up, it will enlarge the foramen. It will enlarge the foramen and it will make it teardrop shape or bigger. So this is called as a transportation of apical foramen, relocation of the apical foramen. So it will actually transport the apical foramen. Now you don't have any gutta which is teardrop shape or oval. You have round gutta. So you when you put a round gutta there is the space all around, and that is one of the reason of failure. So that's why there is the modification which we require. So what is required in the modification? First thing is loss of shape memory. I don't want shape memory. My file, if it is going in the curve canal, should stay there, prepare that portion, and should not transport my apical foramen. Should not make it teardrop shape. Should keep it round only. And second advantage is I don't want to miss my super elasticity. So I want super elastic, super flexible file, but without shape memory. So how to get it? That's why researcher had done some kind of a treatment of files, night type metal, and that treatment is called as a heat treatment. Okay, so there are newer generation of file which are heat treated night eye file and electric discharge machining files. That means EDM files. EDM is a specific process by which we make the files from night eye blank. Now, what are the different kind of files as far as the night eye is concerned? In market, there are Pro Taper Universal, Hero Shaper from Micromega, Pro Taper is from Dentsply, RevoS from Micromega. Now, I don't feel that whether they are still having it. Web 1 and Reciproc are the reciprocating file from Dentsply and VDW. Okay, these are the examples of night eye files. And what are the heat treated files? Examples of heat treated files: twisted file from Kerr, Protaper Gold, flex file from New Endo, Web 1 Gold, and beautiful file from Coltin, that is Highflex CM, and V taper from SS White. So these are the few examples of heat treated files. There are so many heat treated files available all around the globe. Every new day will give rise to one new name of the file, one new file system in the market. That doesn't mean that you should have all the files in your kitty. You can have certain amount of files which are required, and whichever whatever file you are comfortable with, and you should be able to treat all the cases with those. And we're going to discuss that only in the advanced workshop. So what are the advantage of heat treated files? They are more elastic and flexible than nighttime, and there is a loss of shape memory. Hence, it causes the less transportation of the canal. And these instruments are useful in the minimally invasive endodontics. EDM files, there are two examples as far as I have used them. Hyflex EDM from Coltin and neoendoidium from Oricam, I think. Okay. So now see the concept of taper. Now, if you go on looking at the definition, it confuses you. What is taper? It is increase in diameter per millimeter increase in length. What does this mean? For example, I have 20 number file, 2%. That means tip of my file is 20 number. So every millimeter, if I go from that tip up from that tip, I'll get rise raise of 2222 unit. That means tip will be 20, 1 millimeter away from the tip will be 22, 2 millimeter away 24, 26, 28. That is what is called as a 2%. If I have same instrument diameter like 20 but it is 4%, then at the tip it will be 20 only, but 1 millimeter from the tip it will be 24, 2 millimeter it will be 28, 3 millimeter it will be 32, and so on. If I take 6%, there will be a rise of 6 units per millimeter increasing from the. So if I have 20 number 5, but my taper is different, 2%, 4%, and 6%, then what will I get? I get something like this. I get a file 2% which is thin, slender, and if I take a file 6%, it will be thick with the bulk of the mass. So which file is flexible? Whichever file is having lesser taper is always flexible than the file which is having a greater taper. That means the taper or the flexibility of the file is inversely proportional to the taper. So more is the taper, less is flexibility. Less is the taper, more is flexibility. Where do you require the flexibility? You require a flexibility in the canal which is more curved. So now there is a important tip for you. If you have a case with a curved canal, you can choose a file with a lesser taper so that your file will be flexible to reach the intricacies of the canal, follow the curvature properly. If you have a straighter canal, you can go with the higher taper. Understand? So that is how who is going to decide. You are going to decide and your case is going to decide. That's why you should have a very good pre-operative X-ray, pre-operative IOPA. And then IOPA has to be seen properly by you. Do not be in hurry to look at the preoperative X-ray. You have to look at it, check for coronal part. Is there any calcification? What is the shape of the chamber, height of the chamber, dimension of the chamber, from where curvature starts, how the where is the curvature of the canal, where it is maximum, where it is minimum, is there any apical curvature? Can you see the apex? These many things you have to see in IOPA, and then you start proceeding for your treatment. Do not blindly just start opening up the things. Otherwise, you will land up in the problems, and then you will be sitting in some kind of advanced workshop for removal of instruments and bypassing the ledges and all. You have to, if you want to be good in endo, stick to the basics, and these are the basics. Okay, so let's go ahead. So this is the same. Taper is inversely proportional to flexibility, or flexibility is inversely proportional to the taper. Okay, I had just given you the example. Let us see what are the different types of files depending on the taper. There are two different types of files. One is fixed or constant taper. Second is variable or progressively taper. Fixed or constant taper means if I take a 20 number file 4%, there is a constant rise of diameter by 4444 unit. Okay. But if I take a progressively taper file, I have a file with a with a taper like 4% for first 2 millimeter, 6% for next 3 millimeter, 8% for next 2 millimeter, like this. So I have less taper at the tip, little more in the middle, and even more in the coronal part. So what is the advantage of this progressively taper file? It is quite flexible at tip, at the end, and it is quite sturdy at the coronal part of that file. How will it be used? Single file is used to prepare the coronal part on the top, and it will remain flexible when it goes in the curved part. Understand? Where will you use the stiffer file? Where will you use the bulkier file? Where you require to overcome the resistance. Where is the maximum resistance in the canal? It is in the coronal part. Why? Coronal part has maximum of pulp. It has maximum of pulp stone. It has dentinal triangle. It has fibrosed pulp. So all the resistance is maximum in the coronal part. So the file which is bigger in taper in the coronal part is useful to prepare the coronal one third. Whereas the pulp is lesser in the apical third, middle third. So you require a flexible part of the file in the middle and apical third. So what will I do? I would like to use the both the files, both different files if I am using a constant taper. But now I have a file which gives me all the taper in single file. So why not to use the single file for entire canal? So that is the advantage of progressively taper file. Okay. So according to me, you should have both the type of files in your kitty. Even if you are comfortable with the constant taper file, certain time you require to have a progressively taper file in your kitty. Doesn't mean that you cannot prepare the canal with the constant taper. You can definitely go ahead and prepare the canal with the constant taper, but you may require little more files uh, for the preparation. Okay. So these are the example of constant taper. Constant taper means what? If I say my file is 20 number 4%, that means my file will be every millimeter, the my file will be having a tip of 20 number, and with the progressively every millimeter there will be the increase of diameter by 4 unit: 20, 24, 28, 32, 36, 40, and so on. Understand? So there is the constant increase. Whereas progressively, what says? It has 4% for 3 millimeter, 6% for 2 millimeters more, and 8% for 2 more millimeters. Understand? So it gives you the shape like this. Understand? It gives you the progressively taper will give you the shape like this. Okay. Examples of constant taper: Highflex CM, profiles, hero shaper. So many files are there with the constant taper. You must be having it everywhere. Edge endo is also there. Okay. And this is the progressively taper file, where if you see that yellow portion is the flexible, more flexible part with the lesser taper. In the middle part, blue portion, and the top part, green portions, are a higher taper or greater tapers. So they are less flexible, used to prepare the coronal part, whereas the flexibility is required in the middle and apical part. So this files prepares the canal more efficiently, faster than the constant taper file. But the disadvantage of file or caution, you have to be. What is the limitation of the file? It breaks more. Why? You try to push the file, it will break because it has the flexible part dangling down, but the upper part is absolutely fixed in the canal. The moment you try to push, this grip will not be loosened, but file will be broken. So that's why you have to be cautious while using progressively taper file. Okay. So this is just for the example. These are the picture of hand file, but actually this is a pro taper. So if you see these files, these are the progressive taper files. Okay. So how will you select the taper? By studying the preoperative x-ray for the canal curvature and the root width. The highest possible taper within the safety limit for that particular situation should be selected for that case. Okay. And taper is dictated by canal anatomy and curvature and root morphology. Okay. So I will not go into the details of how to use the instruments. I will give you the demonstration on the day of workshop. So I'll just go through these slides. These are all slides. Okay. So that is how it is. Now, when will you use the work apex locator? You will use the apex locator after you prepare the coronal part, because coronal interference is out, your tactile sensation will be better. Now when interference is out, your canal curvature is also less. Now you take the working length with the the apex locator. Why apex locator? Apical, this is called as apical control zone. At the tip, you have apical foramen, but apical foramen is not the point. It is the funnel shaped entity, which is having a minor diameter here, top, and the major diameter down under. If you see the diagram, you have to be short of that minor diameter also, and that's called as apical constriction, most constricted part of the canal. And now that apical constriction is better determined by apex locator three-dimensionally. For example, see the X-ray. X-ray seems to be fine, 0.5 millimeter short of the tip. But if you see actual picture, my file is out. So every file I will carry out every time. So I will be forming the wound inside the bone. So now you think about it. When I'll be putting my GP along with the sealer, I'm actually pushing the sealer inside the bone. That's why our patient gets pain for 7 more days because you have already over obturated. But your X-ray shows absolutely fantastic root canal with the apical puff. So these are very important tips why to use the apex locator. So thank you very much, friends. This is for the instrumentation, very much basic. I would like you to just understand. That's it. Whatever way you are preparing, that is the best way. We will discuss everything out in the advanced workshop. Thank you so much. So I'll be checking out now.